Okay, perfect.
Great. All right. Ladies and gentlemen, welcome back to our international ground rounds. I'm very pleased to have one of our guests today is Luciana Kase, MD, PhD. Good morning, Luciana.
Good morning, Puya. Good morning, everybody. Pleasure to be here with you.
So, for those who don't know, Luciana is part of the University Hospital of Montpellier in France, and she is also part of the WHO Collaborating Center of Scientific Classification Support, also in Montpellier, France. I was very impressed by the work that she recently published regarding the global implementation of the WHO, and she will go through this and she will tell us more regarding what she did for this paper and what were exactly those information regarding this. And it specifically was regarding the classification of diseases, ICD-11, on allergic and hypersensitivity condition model. So Luciana today, she's going to go through all of this, and the presentation will be based on this. For those who attended for the first time, do remind that all the questions should be typed by using the chat board, even if you're participating from YouTube, from Facebook, from Twitch, or whatever. All the questions should be answered at the end of her talk. So if you're ready, Luciana, please share your screen.
Okay.
There you go. Thank you so much.
Okay, so I would like to thank you very much, Puya, for the kind invitation. It's a great pleasure to be with you in this great initiative of this association. And my task here today is talk about what I have been doing over the last 8 years. That is the representation of allergic and hypersensitive conditions in the international classifications of the WHO. In fact, let me introduce my background. Although I have this Japanese phenotype, I'm Brazilian and I'm based in France since 2015 now. So I will tell, this is important because you will understand the story of this ICD-11 representation. So for this, I would like to propose a very brief agenda with 3 topics, just to have the background of this initiative, explain a little bit of the allergy and in ICD-11 initiative, which has been launched in a very academic and technical way to have this implementation and in fact, the purpose of this last publication. So let's start about, with the big picture about allergies. I know that I'm talking about mostly an audience of ENT doctors, but we may have other doctors and other health professionals interested in the field as well. So when we are talking about allergies, we are talking about a very complex field, because allergy and hypersensitivity we can consider as a very transversal discipline in which we touch many other specialties such as ENT and very many others. So we have different profiles of allergic conditions, and mostly we have 2 main types of conditions. The most severe ones, such as anaphylaxis, severe asthma, that are very life-threatening. However, we have another profile of conditions such as urticaria, allergic rhinitis, dermatitis, which are much more prevalent, but these are very, very annoying. I mean, they have a very huge impact in the quality of life of the patients, and sometimes they can implicate in very huge impact in socioeconomic burden of these conditions. So In fact, when we are talking about these allergic conditions, we know that they are increasing dramatically over the last years. And here in Europe, we are expecting that in 2025, 50% of the European population will be allergic. Can you imagine this? It's amazing. I mean, in fact, we consider as, well, my background is allergy and clinical immunology. We consider this increase of allergic diseases a kind of marker of the different changes on immune system due to many uh, uh, different stimulus of the environment. I mean, for example, air pollution. We have more clean environments for children, for example. So many things are changing, and we have an increase of these conditions worldwide, not just in Europe. And when we are talking about the international classification of diseases, I would like to know if you are aware of this classification. Is it something that you are familiar to? Well, I would have, I would like to explain briefly what this condition, what is this classification in order to provide you more information. So this classification that's really international is provided and supported by the WHO. It has been launched many years ago at the time of the second war, when they were willing to record the mortality data. But of course, this classification has been evolving so far, and we have many editions. I mean, now we are currently working in the 10th edition of the ICD worldwide, and it's used worldwide, translated in 43 languages, used in more than 100 countries, and it's very, very important because most of the data in terms of epidemiology, national health systems are based on the ICD, and in fact, it's generate money. Is responsible of more than 70% of the allocation of resources in, related to health. So it means that if a condition or a specialty or a group of conditions are not well represented in this type of classification, you do not exist in the health system, and you will not have any effort or any investments of the higher level in terms of public health in order to manage these conditions. So saying that, I would like to invite you to take the example of anaphylaxis. I know that most of you are ENT, but anaphylaxis is something that most of you may have heard or have seen, and there's a reason why I'm taking anaphylaxis as an example, because in fact it's a killing allergy and killing hypersensitivity. And more than that, in 2012, when I started this initiative together, Pascal Demoli and other colleagues, in fact, I was still in Brazil. And as you may know, in Brazil, we still don't have the auto-injectable adrenaline to offer to our patients. In fact, it was very, very frustrating to be allergic, to be responsible for the correct diagnosis of our patients, but unable to prescribe the drug to save these patients. So most of the patients would be death outside of the health system. So in fact, I started this initiative in a very, I would say, research profile. When I searched for the deaths related to anaphylaxis in the Brazilian mortality information system, that's really organized. In fact, I looked for the data from 3 years and evaluated more than 3 million of files of, and in fact, yes, based on ICD. And what was astonishing is that I found zero deaths due to anaphylaxis. And why? Because anaphylaxis has never been well classified in the ICD. And more than that, due to this bad classification, the WHO coding rules for mortality has never considered anaphylaxis as underlying cause of death. So even if you wish, you cannot die for anaphylaxis. It was the problem. And this is what we have in the ICD. The ICD is an open platform. You can access it virtually. So I take this example of the ICD-10, this new version, in fact, and when we type allergy as the main search, we are addressed directly to the chapter T78. It's amazing. It's called adverse effect, not else classified. So, and in fact, under this chapter, we have, of course, anaphylaxis, but only the severe cases. We have the only mention of food allergy here. And more than that, angioedema and allergy inspecified are in the same level. So what hell, it was a very kind of mess. We have never been well classified, in fact, in the ICD. And the main outcome of this kind of bad classification is here, for example. In this world map, all these countries in gray are those that do not have auto-injectable adrenaline for the patients. So the patients are dying. Mostly, if you can see, are middle and low income countries. So we have a lot to do, but we started with the initiative due to this kind of bad situation. And in fact, in 2012, when I first published that research, was exactly the moment in which the ICD launched, the WHO launched the ICD-11 revision, what was timely perfect. So we started annoying the WHO people responsible for this, because as we have never been well represented, we had never had any representation as well in this revision. So we started annoying people, sending a lot of emails. Of course, in the first hundreds of emails, I had been ignored, and but little by little providing all the data, because we have been publishing all the steps, main steps of this initiative. We provided these documents in order to prove the need of changes. And we, together with all these publications, we engage the main allergy societies. So we have EAACI, WOW, two American societies, the Latin American Society and the Asian Pacific. All of them have been acknowledging our activities, and we gain some respect on this. And at the end of 2014, the WHO main group sent me an email. Okay, Luciana, come to Geneva, to the WHO, to discuss, because you will never stop annoying us. So it worked well. And in fact, it was a very interesting discussion. We could convince them the need, about the need of having a specific chapter addressed to allergic and hypersensitive conditions. And during the holidays of Carnival of the 2015, I was building up the first chapter addressed to our specialty. It was a very tough, this building up construction, because in fact, each word of this chapter had to be evidence-based on publications, had to be discussed with all the other specialties with whom we have overlappings. For example, for the respiratory, of course, we had discussions with the ENT group, the pneumology, and many other specialists. So here is the chapter of the allergic and hypersensitive conditions. We have more than, I would say, 600 conditions listed there. Of course, here are the main terms of these main headings of this classification. Is just to have an overlook on this. You may be very curious about the ENT part of related to allergic conditions. So, of course, we have a very big ENT on this, but when we search for allergic rhinitis, for example, we are addressed here to where the physician can read this condition through the new chapter that's called diseases of the immune system, or by the respiratory diseases of the respiratory system. So we call this as parented chapter, so we share many conditions of the other chapters. And more than this ICD-11 brings much more knowledge on this. It's not just the classification of the diseases, but we can bring more details, given more, for example, characters related to the pattern, intermittent, persistent, or for example, the severity, or even the etiology, if it's related to allergens or other condition. So it's a very small example of what we have now. And related to anaphylaxis, we could prove in fact that it was really effective, because I reanalyzed all the data of 2012 with the ICD-11 perspective, and we had amazing result on this. And by the way, I will leave my email address. If you are interested, I can share all these publications, and we have been providing the newsletter as well. So it will be interesting to know who are interested on this and would like to collaborate, because we will have many more steps on this. And more this than changing the classification, we succeeded on changing the mortality coding rules. And now allergic conditions, and including, of course, anaphylaxis, can be underlying cause of death in the death certificates. So now we can have more accurate data. I review all this process in this publication. Is just to have an overview of all this background. And if you wish, I can share with you as well. And due to all this effort, in fact, we here in Montpellier, we have been designated as the collaborating center, but it is the only one covering allergic and hypersensitive conditions. So we are very proud of, but it's much more responsibility and work, of course. In May 2019, the ICD-11 has been presented in the World Health Assembly to all the ministers of health of all countries, and has been endorsed. So the ICD-11 is finally adopted. The conclusion of all this is that we will have more accurate data, not just for allergic and hypersensitive conditions, but many other conditions that have been updated over these years. And more than that, now, due to this chapter, we consider that the WHO now recognize allergy as a full specialty, different from before. About the global implementation of the ICD-11, we have a lot of things to do, such as translating things, try to provide evidence-based data. And one of these is the publication was the reason of my invitation by Puya. And in fact, we surveyed health professionals and offered this chapter in order to peer review terminology, classification, and definitions. So as outcome, we have more than 400 responses representing 74 countries. Of course, it's not too many, but we consider here the quality of the responses, because it was a very, I would say, long survey in terms of technical aspects. So as outcome of this process, we propose here a score system to evaluate the accuracy of these main conditions. So here are the outcomes we evaluated. I clustered here, for example, the respiratory disorders related to allergic and hypersensitive conditions together with the eye. And as we can see here, in fact, is that most of the participants were happy with the new classification, scoring most of them in grade 3 and grade 4. Some of these conditions have not a very good evaluation, but in this survey, I propose an open slot in which the participants could provide their opinion and suggestions. And it was indeed very useful, because I used these suggestions in order to refine this ICD-11, because in fact, although this ICD-11 has been adopted, the main framework is stable, but we are now responsible for the refinements of this classification. So what we have now in our agenda, the full implementation of the ICD-11 is expected up to 2022. Of course, it will depend on the health system of each country. For example, in France, I know here that we are in some delay. Maybe we will delay 1 year. But during this period, we will have a lot of things to do to support the WHO in this implementation. And following this period, we will have a period that is called monitoring process, in which we will have to follow up all this data provided based on the ICD-11. But I'm sure that all these efforts are worth and will be worth not just for allergists, but for all professionals that are dealing with these conditions. And with this, I believe we will reach this proposal of the WHO, that's the universal health coverage for everyone and everywhere. So I leave here my email address to you. And I would like to finish this presentation. Thank you again, Puya, and thank you all for this, the attendance to this teleconference. And I will be amazed to meet you in person in forthcoming congresses and discuss things with you. So, and maybe if you can, if you have some questions now, we can share.
Yeah, of course. Thank you. First of all, thank you, Luciana, for the presentation. We have a bunch of very lots of questions. I will try to manage it. Some of the questions are regarding the previous slides. However, I do believe that you already covered those topics. So in order to do it, I will skip and we go ahead.
Okay.
Thank you also for your email. For anyone interested, please type luciana.tanno@gmail.com for any other questions that will not be answered at the end of his his panel. So of this panel was basically, let me just quit the participant sharing, was based on something that demonstrate the validity and the importance of having a kind of a scoring system and a platform in which everyone discuss the same language. Talking and expressing the same language is essential because from worldwide, if we don't speak the same language, it happens. Things can happen like the anaphylaxis that you propose and you shared. So here comes the question. The first question is coming from Germany, and this colleagues is asking: is there anywhere we can see those ICD news up to date?
Yes, in fact, the platform is open as well. So just type ICD-11, even in Google, you can have the full access to this classification.
Okay. And here comes the second question, which is basically similar to this from Portugal, and the colleagues is a male is asking, what if our institution do not recognize ICDs? So
Well, in fact, I would say that most of countries recognize the ICD as the main tool for recording epidemiological data. For specific institutions, I mean, for hospitals not using the ICD, they are using other classifications that are may be linked to the ICD. For example, the SNOMED CT or the ICPC, the other classifications that are for different purposes, they are all linked to the ICD. So we have a work in the background of the WHO to link all these very high standard, high profile classifications. So I don't think we will lose things, in fact.
uh, here comes the things. I do believe there's some gaps when it comes to reimbursement, because we are talking about diseases and then we have reimbursement based on the ICD classification. And I've been struggling around also when it comes to subcategories, because sometimes we have to categorize patients based on this. This is not something that we are manipulating patients as toys, but it's just to put names and surnames for a kind of diseases, and this is important. I'm sorry for interrupting, but we have to make this clarification, otherwise the people will not understand that this is not something that we want to monetize. This is just a kind of specifics that we have to provide in order to let the people or our colleagues know what we are dealing with. So we have to talk regarding diseases, not money, of course, but is this just the only way to do it? So here comes another question from our colleagues from Saudi Arabia. Did you encounter any difficulties to relate with the WHO? Oh, here's the. Wait,
Oh God, you
I
cannot
was
imagine.
sure about this.
You cannot imagine the hundreds and hundreds of email that I had to send to people to be listened. So it was really difficult, but I can say that I was really lucky because across the process, I met very high standard professionals, very academic, very serious people who are willing to collaborate. Of course, we have different, I would say, priorities of the WHO. The ICD is one of them, but of course, for example, now we have the COVID pandemic and things like that. So sometimes they are somehow concentrate their efforts and in different fields and well, but it's worth it to be annoying with some academic and technical data in the backgrounds. Otherwise they will always ask, who is this person, what she's willing now, you know. But when you start providing data saying, look, I'm working seriously, it's important, let's have a discussion. So it's worthy.
Yeah. There's a question from the Netherlands, and she is asking, this colleague is asking, does the new EPOS guidelines 2020 make changes in the ICD?
Well, I'm not sure about this response. If you would like to send me an email, I can have a look on this and I will get back personally.
All right. So the questions I do believe that is related to the new European position paper that came out on 2020, and I'm just curious when it comes to things like this, if is this automatically changing anything regarding that or not. I will. Once again, at the end of the presentation, I will type your email so that people could understand better.
And
We have time.
just a comment. In fact, all these position papers that have been coming out, because we are living a very noisy period. We have many information, guidelines, position papers, and documents that are providing new data. So what we have been doing in this level of the ICD-11 is different from the ICD-10, for example, that were mostly a kind of three books that we have the list of diseases and it was really boring. Now we have a very electronic profile framework in which we can update things easily. So even if we have new guidelines, I believe we can adopt things based on evidence. So it's what we have been doing.
All right. So any changes as schematically uh, change it live or something like this, if I did understand, or it may changes are easier now than before.
Yes, it's easier now than before because it's 100% digital, it's electronic. In fact, although the main framework is stable, I would say, for example, we cannot change, I would say, asthma from the respiratory and including another chapter directly, I would say. But if you prove that is needed, it will happen.
All right. So we have time just for other two questions. The first one is coming once again from India, and this colleagues is asking, does the ICD changes also for treatment modalities?
Well, treatment are somehow covered, but not 100%. We have another WHO classification that is the international classifications of health interventions. This one will be released soon as well. We are implicated on this, and in fact, in this classification, we have much more interventions, which will be useful in our practice.
Okay. So last question I would like to ask from myself is there any chance for having more guidelines available everywhere when it comes to places where they don't have actually the possibility to assign ICD by a computer or from a machine, and how we can implement those areas to get more direct contact with the WHO or agencies or representative from their nation and to provide those information.
So related to these informations, they are launching a kind of guide in order to provide more information how to use the ICD-11. I know that besides all this digital framework, we will have the print versions of the ICD-11 what can be useful for those countries in which the internet access is not very easy. And in fact, the way to access to read the WHO truth the country is truth the ministers of health. In fact, so if you are in association, for example, you are representing something. And you can try to first step try to assess or have some discussions with the Minister of Health, and the Minister of Health is responsible to address this information to the WHO.
Perfect. So now that everyone does clear what are the processes to get in there, what are the processes for the ICD, what are the purposes, and how to change those things. Any other questions, please? Once again, Luciana, I would like to provide your email. So if I'm not correct, please bring it back. Luciana dot Tanno@gmail.com.
Yes, perfect.
Perfect. So thank you so much, Luciana. I hope that everyone understood the facilities that we brought. And then for anyone interested, this webinar is going directly in our Association Naso Sano Facebook pages and YouTube. You can watch it. You can share it. Please share and subscribe for future consultation. We before the beginning of this panel, we had some discussion for implementing our activities and bringing some future collaboration. Thank you, Luciana, for
Thank you
for
very
being
much.
with us. It was so good to have this discussion. I really hope that this whole pandemic will stop soon and meet you personally once this will end. Thank you so much. Have a good night.
Thank you very much, everybody. Ciao, Puja.
You guys, bye. Oh, for those who's interested, I'm sorry, for next week we are going to have Casper van der Meulen. He's going to talk about breathing techniques and how those breathing techniques will affect us and how we can control those breathing technique for implementing or controlling autonomic system. And this is going to be fun. And just check out our Facebook pages. Have a good weekend.
Ciao.